Good morning, Mrs. Smith. I just wanted to come in and see you before you're discharged and do a little bit of medication teaching with you. Is this your daughter, Sarah? Awesome. I'm so glad that she's here. It's awesome to have a second set of ears and to have someone to also be able to ask questions. So I'm just going to get into some teaching and we'll all collaborate. And then at the end, I'm going to have you guys do the teach back method to me, which shows you kind of what you learned and what you may still have questions on, and then we can go from there, okay? So I know Dr. Collins came in earlier this morning to kind of discuss how asthma works, the implications, and he also mentioned that he would be sending you home with a prescription for albuterol, which you've been using in the hospital. And I just kind of want to discuss first what albuterol is and what it does. So there are short-acting bronchodilators and there are long-acting bronchodilators. And essentially what bronchodilators do is they prevent and control the constriction of the airway caused by asthma and other respiratory issues. So this short-acting bronchodilator helps you in a pinch. They're often called rescue inhalers. A long-acting bronchodilator works throughout a longer period of time. So, Mrs. Smith, I know you mentioned you love running outside, and this is something that then at that point you would definitely take with you. So if you suddenly became really short of breath, out of the usual shortness of breath from running, then you would use your inhaler. But this is appropriate to use anywhere. It doesn't always have to be induced by exercise. So even if you're just cleaning your home or going on a walk or something like that, it could be an appropriate time to use it. With that being said, it's really important that you have it with you at all times. So if you're heading to the grocery store or the gym, just make sure you have it in your bag. And what I really like to tell patients is we remember to take our keys, we remember to take our wallet, kind of imagine it as being added to those list of things that you just always need to have on you. So it's very important that you understand the side effects of any medication, including albuterol. There are a couple hallmark side effects that patients usually report when using this medication. So many people report a sense of restlessness or anxiety, and they also report the feeling that their heart is beating out of their chest or just very, very, very fast. The reason it's so important to understand the side effects of a medication is because you want to know what to potentially expect. If these side effects hit you out of the blue, you may feel very confused and extremely worried and wondering what's going on. So if you're able to anticipate them and process them and know what to do about them, then you'll have a much easier time adjusting to the medication. You always want to use the albuterol as directed from your physician, Dr. Collins, and it will also be printed on the label from the pharmacy, and we'll also go over it in our demonstration today. If your shortness of breath is not relieved, it is extremely important to get in touch with a healthcare provider immediately. All right, so we're going to go ahead and get into the actual unit and how we're going to use it. So when you first get the albuterol, you're going to take it out of the package like this, and you are going to shake it up very well, and then you're going to prime it with 4 sprays, and you're going to do this each time you receive a new canister. So 1, 2, 3, 4. It's also important to know that after 200 sprays, you should discard it. After your inhaler's primed, you're going to go ahead and shake very, very well. You're going to take your first puff, which will be a breath out, in, and out. You're going to wait at least 1 minute between your first and your next puff or inhalation. This medication can cause somewhat of an unusual taste in your mouth, so after a dose, it is important that you go ahead and rinse your mouth out with water just to prevent that buildup of that taste in your mouth. Mrs. Smith, I know you asked me earlier about keeping the mouthpiece clean as well. So what you'll do for that is just rinse it with plain water once a week. If your symptoms continue with this medication or the contents of your canister is empty within 2 weeks, it is extremely important to reach out to your doctor so they can reevaluate your plan. All right, Mrs. Smith and Sarah, we're going to go ahead and get into the teach back portion of the medication teaching. All right, so we're going to go ahead and take the inhaler, and I would just like you to show me a demonstration of how you would use it if you were out on a run and you were short of breath. Awesome. I'm very glad to see that you were able to determine which part was the canister, which part was the mouthpiece, and that you also shook the medication. It's extremely important to shake it even if it's urgent. Can you describe a couple of the side effects that I noted? I also want you to tell me how those side effects make you feel. Do you have any concerns about them? I certainly understand your concern for the side effect of anxiety. There are many, many resources available to address this and help you work through it if you do face it. There are things such as guided imagery, deep breathing, relaxation exercises. I can definitely get you some information on those in advance. If you have any more questions before discharge, Mrs. Smith, please let me know. The most important thing is that you feel confident in administering your medication in a safe way, and that you fully understand what exactly you're putting in your body and how to use it.